Ina Agustin makes sure her household is prepared if and when a coronavirus infection strikes. On top of her list, medical supplies. She believes it's best to be prepared for a household of 10.
Nagde-develop ng fear. So ako, naghahanda lang ako. Siyempre, parang mga ants, di ba? Saving for the rainy day. Oximeter, yung pang-record ng BP, and also yung pulse, for pulse rate, thermometer also.
Experts say home care may be done for asymptomatic cases and those with mild to moderate symptoms without risk factors. Among the must-haves, a reliable caregiver and the patient's clinical evaluation.
Dapat mild. Meaning, nakakahinga ng maayos, nakaka-function for their daily activities, nakakakain ng maayos. Kasi the whole point is this person should really be well enough to be taking care of himself or herself.
Essentials for a COVID home care kit, PPEs. Gowns or jumpsuits are not required, just a face mask and face shield. Cleaning and disinfection supplies. Monitoring supplies to record the patient's vital signs, medication for fever, cough, and maintenance drugs. The patient should have a separate room and bathroom with good airflow. The room door should always be closed. The patient's food and other needs should be handed over without contact with other family members. If there is more than one patient in the family, they should be in separate rooms if possible. If not, the patients should be separated a meter apart. They should always wear face masks. Vital signs should be checked at least once a day. Watch out for symptoms that could indicate worsening condition, such as difficulty in breathing because of low oxygen, chest pain, lightheadedness, or dehydration. The caretaker should be constantly communicating with a doctor for patient monitoring. Dr. Anna Ong Lim says studies show a COVID-19 patient is no longer contagious 10 days after the onset of symptoms. For asymptomatic patients, that's 10 days after the virus test. A follow-up COVID-19 test is no longer needed if the person completes the 14-day isolation.
Mas rational yun. No? I-interviewin siya nung healthcare provider ng company, tapos mag-i-issue ng fit to work.
Ong Lim says while many of us know how to treat and recover from some diseases at home, we can consider the same thing for COVID-19, especially since up to 97% of cases are mild.
A lot of what we're doing for COVID is driven by fear. So, paano natin yan maka-counteract? We need to understand it better so that our actions are rational, so that when we intervene, measure din yung response natin. Hindi natin sinasabing binabaliwala natin siya, pero hindi rin naman tayo nag-edge towards yun sa sobrang, parang kapramingan.
Ruth Cabal, CNN Philippines.